I'm Dr. Patricia Mills, and I'm a medical doctor, functional medicine practitioner, health transformation expert, and I'm so passionate about your health. I'm doing this on the regular to help women like you better understand your own bodies so that you can feel like you're actually thriving versus just surviving in today's modern world. And squeeze as much joy and happiness as you can out of your existence. And something that really squeezes out the joy and happiness for people is the experience of menopause. So, what can happen is that you're going through your life and then you go into menopause, and then things kind of shift and change in not such a good way. And that can last for a long period of time or a short period of time, or it can feel like it lasts forever. And so, your golden years that you've been looking forward to when you retire and you want to travel and all that kind of stuff get sort of taken over by this experience. And that can be the case for a lot of women. So, today, what I want to do is I want to demystify menopause. Okay. I want to explain menopause to you in a way that is like easy to understand and gives you some perspective and as to what's going on underneath, like behind the scenes in your body, right? And once you know the why, we can bring in some tips for how to make that experience better. Now, I was going to have Natasha Sampson join me today, Ayurveda teacher. However, yesterday we spent about an hour trying to figure out what happened with Facebook, that they all of a sudden are not allowing guests to join and go live at the same time, and we simply could not figure it out. So I will continue to work on that, but today it'll be me explaining to you demystifying menopause, okay? And again, if you're joining me, please put in your name, where you're joining me in from, so I can see the comments. Right now, it doesn't look like I'm seeing any comments, so my apologies if that's the case, but put in your questions as they come up, because now afterwards I'll go back in and answer your questions by typing them out if I don't see them live here, okay? Okay, first, it's important to understand what is menopause, all right? So there's premenopause, perimenopause, and menopause, okay? Premenopause are the years when you are menstruating and you're fertile. Those are kind of like from the time that you start menstruating up until the time that your menstruation starts to change in its pattern, and not because of like necessarily like a medication that you take like an oral contraceptive, but rather a process that for most women happens around between the ages of 45 to 55. The average is 51 to go into menopause. And perimenopause is the shift. It's when you start to notice changes in your body that reflect the underlying hormonal changes that are going on. So the hormonal changes are happening as a result of the organs that make the hormones changing in their function. So every organ, and we're speaking primarily about the ovaries, but every organ has a function that is determined by the genes that are turned on and off in that organ. And there are genes that are turned on and off like a clock according to our age. So, for example, the ovarian clock has like a limit as to how long it's going to perform that specific function. And then after, when you reach that limit, it'll turn off, so to speak, and then the ovaries retire and other organs take over, like the adrenal glands, to make hormones. There are other things that can turn off that can change the genes and turn off those genes, so to speak, and that's things like medication, retire, and other organs. Let me see, sorry. Oh, I can see the comments. Here we go. I had to click on oh, Natasha. Hi, Natasha. It's wonderful. We were going to see if we could bring Natasha live, but I don't actually see how to do that here, so that's really too bad. We were hoping to be able to bring Natasha in. And Ushi, hi Ushi, hi Ursula. So nice to see you too. That's so wonderful. Okay, I can see the comments. That's great. So other things that can turn off the genes of functioning in your ovaries are things like medications. So some people have to take certain medications for other medical conditions, and it affects the genetic expression in the ovaries and the uterus, for example, that whole reproductive system, and it'll cause that function to change and to shut off. And sometimes they can be turned back on again if that's the case, like the medication is stopped, the medical condition resolves itself. like, for example, diabetes or blood sugar, too high blood sugar consistently over time, which leads to insulin resistance. That's insulin is a hormone for sugar. That can change the function of your ovaries. And so you can get into polycystic ovarian syndrome, for example, where that's a level of dysfunction that is at least partially due to this insulin resistance from things like too much fast protein, too much fast carbs. And if you're wondering what I mean about fast carbs, I encourage you, if you're in my Facebook group watching this, Wild Wisdom for Women with Dr. Patricia Mills, because I also post these events in other sources like my Patreon page and some on YouTube. You can go into the About section and you can download my free ebook on how to balance your hormones naturally. And I explain exactly what are fast carbs and fast protein. That's usually protein powder, which is why I do not recommend protein powder, because I think it has a strong hormonal effect. And so, for example, if you're someone who's having a lot of fast carbs unbeknownst to you and you're triggering the insulin a lot, that has been shown to affect the functioning of the ovaries so that the ovaries no longer are producing the adequate amount of estrogen and testosterone and progesterone, and that can lead you to polycystic ovarian syndrome, which is just a fancy word for various things in the body start to occur, because it's just not the ovaries that are affected, it's other parts of the body too. But at the level of the ovaries, that will affect things like your menstruation and your fertility, okay? Other things that will affect your hormones and cause like an early menopausal state, so to speak, are surgery. So you have to have surgery, and sometimes oral contraceptives, right? You give but that happens at a different level actually. Oral contraceptives or hormonal replacement therapy, what that does is when the body starts to sense that there's a lot of other hormones being added to it, the brain stops communicating with the ovaries to produce its own hormones. So it's actually it stops the brain from talking to the ovaries to create hormones. So you can get these like altered patterns in your hormones and menstruation before menopause. But let's say you don't have any of that going on. Oh, another thing is like Fragile X syndrome. So that's a genetic predisposition to go into menopause early. So it's like your ovarian clock is like times out at like, in your early 30s or even 20s, for example, versus the average 45 to 55 with a mean of 51 years of menopause. Perimenopause is when you start to see those shifts. So the clock is, so to speak, like changing, and the ovaries are starting to turn down, and you go through periods, and you go through like a shift, right? And then menopause after that is when, by technically, so in perimenopause, you're having a lot of changes in your period. And in menopause, by definition, you've had 1 year without your period. That's the definition of menopause. Hi, Vera. Nice to see you. Thanks for joining. Wonderful. And so you have your pre-menopause, your around menopause, so that's shifting, and you have your menopause, which is a year of no periods. And then typically speaking, you don't tend to have periods after that. And if you do have bleeding after that, then you have to go and get investigated for something going on in your uterus, like uterine cancer or something like that. So that would be like abnormal. Versus in perimenopause, the shift between pre and menopause, it's like this roller coaster of hormones that occurs. And that phase can last 5 years to 13 years. Hi, Susan. Thanks for joining. Wonderful to see you virtually. Wonderful. So that phase can last from 5 to 13 years. That can be extremely frustrating for a woman, right? Like, because that's a phase of like a lot of change. So you don't get the predictability of your monthly, right? Or, yeah, you don't get the predictability of your monthly. So it's really hard. So some months you can even have like, you start to notice changes, and then for a few months it can go back to normal, and then for a few months it's completely all over the map, and then for like a couple weeks it's back to normal, and then it's kind of like this da 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 da, and then it slowly starts to even out, and then it evens out into menopause. So what is happening behind the scenes when you're going from pre-menopause to perimenopause? So what happens is that many organs in the body actually make hormones. We know the ovaries as being the big producers in women, but did you know that the adrenal glands also make hormones like estrogen, progesterone, and testosterone, and DHEA, which is like the before estrogen and testosterone? And the ovaries, and also your fat cells actually make hormones, which is very interesting. So if you have too many fat cells, that can affect your hormone production. Your gut makes hormones. Okay, huge hormone producer, which is very interesting. Every cell in the body has the capacity of making hormones because they all have the same DNA. It just depends what part of the DNA is turned on and off. That's evidenced by the fact that cancer cells can make hormones too, because they have a change in how the gene is expressed, so turned on and off. Okay, so what happens then is that you basically have the over perimenopause is that progesterone, which is like your feel good hormone, your chill hormone, it helps you sleep at night, it helps you get pregnant, like it supports the beginning of pregnancy, and then the first trimester you need to have really good progesterone to get pregnant. You still need progesterone like in good levels after that, but that's like a really crucial stage. But in menopause, it's like the feel-good hormone, the chill hormone, the sleeping well hormone. And the progesterone is before perimenopause, like in your fertile years, is primarily made by the ovary when the when the egg is released halfway through your cycle. That the leftover sac, which is called the corpus luteum, releases progesterone for the remaining 2 weeks of your cycle. If you think of your cycle as 4 weeks, it's released in the last 2 weeks of your cycle. So you have this like beautiful kind of like progesterone is like there because why is it there? Because it's still made by your adrenal glands. Your adrenal glands do make some progesterone. And then but your ovaries are more in charge of it, so they make the most at that time. So your progesterone levels are here, then you ovulate, the egg gets released from the ovary, your progesterone levels go up for those last 2 weeks of the cycle, and then they naturally come back down again after menstruation. People who have premenstrual syndrome, PMS, and sometimes it can be really quite severe. That's usually because you don't get that beautiful release of progesterone after ovulation, and that can be because either you didn't ovulate because you're on the oral contraceptive, which blocks ovulation, or it can be due to other factors that block progesterone, which we won't get into now, but I just want you to understand that's what happens. So as you go into menopause, through that perimenopausal state, you're not ovulating, right? You're no longer fertile consistently. You can still get pregnant during perimenopause, but you're not ovulating every single month. So on the months that you don't ovulate, you don't get that nice bump up of progesterone, okay? And so what you might experience very commonly are things like irritability, right? Kind of like feeling like snapping at people. You're not sleeping very well. Like you're kind of starting to wake up through the night, or whatever you had before gets worse. Or if you had PMS, it gets worse. If you had migraines related to your cycle, those can get worse. And then the hot flashes can come on because there are some changes that occur at the level of the brain with menopause, like going with perimenopause, and that's the regulator center in the hypothalamus, and that regulates your temperature, and the temperature regulation can go off, and that's actually because of the brain is influenced by the hormonal levels. So when you start to get these shifts in hormones, those shifts in hormones send different messages to the brain. And one interesting fact is that when you're, let's say like you're going through your perimenopause, transitioning into menopause, and you're getting hot flashes, one of the reasons that the hot flashes can get really bad is because you're under a lot of physical, mental, or emotional stress, which causes your adrenal glands to produce more of the stress hormone cortisol. Cortisol, so when you think about your hormones, is cholesterol is a building block of all of your sex hormones, and then you have pregnenolone, which is the mother hormone, because from pregnenolone you can make progesterone or cortisol. Progesterone first and then cortisol. So cortisol is made from progesterone. So if you have a lot of stress, like you're in a high level stress job, or you're dealing with children at home, or you're helping family members who are sick, or a lot of people are relying on you, and you have not incorporated ways to support your stress in your life to help maintain your perceived stress low, then you're going to be making a lot of cortisol, and which pulls from your progesterone, and now your progesterone goes down. So now you have high cortisol, low progesterone, and that can trigger a hot flash. And when the hot flash happens at night, that's called a night sweat. Okay, so things that you can do, everything that you can do, here's tip number one, everything that you can do to maintain your stress perception low, as in increase your ability to cope with stress, increase your stress resilience, not to put yourself in like isolate yourself into a monastery, because that's obviously not possible, but rather do things like breath work, right? Like as I do presentations, I always make sure to stop and take like a deep and conscious breath, and that just discharges some of like the physical tension that arises from doing live presentations. I love doing live presentations. I absolutely adore them. Um, and they generate a lot of like, physical tension because I have to focus, I have to be attentive. So and so I increase my stress resilience and reduce my perceived stress by taking these conscious breaths throughout the presentation. Or you might meditate every day for like a few minutes in the morning, a few minutes halfway through the day. You might do some things like Qigong and Tai Chi. Remember, some people will say, well, I go out for like a really hard workout, and that's how I deal with my stress. Well, actually, what happens with that is that when you're going for a hard workout, you're not decreasing your cortisol. The cortisol actually goes up because it's a stressful physical event, but you're releasing dopamine, which is a feel-good hormone, and it's kind of like creating an alternate feeling. So it's actually not discharging your stress hormone cortisol. It's just adding a new player into the game, and that player does not help your hormonal balance. Dopamine does not help get your progesterone levels up and your cortisol level down. So when I say you want to manage your stress, I want you to do it with things that are opposite of physical stress. So not like going for a hard workout or like a CrossFit or like a Peloton crazy event or something like that. I mean gentle yoga, gentle Tai Chi. And what that does is it resets your nervous system so that your adrenal glands do not overproduce cortisol, so that they can produce the progesterone, so your adrenal glands can produce progesterone. So this is really neat trick, because once you go into menopause, right, you've transitioned through and you've gone into menopause, you want to really nurture your progesterone, like, and your estrogen and your testosterone, but particularly your progesterone. And the way to do that is to keep your cortisol levels as low as possible through, increasing, like using all of those techniques I mentioned, having a really lovely morning routine, a really lovely nighttime routine. And the other thing that really increases cortisol is if you don't have good melatonin, which is the hormone of darkness, which should be released at nighttime if it has no blue light exposure. So I often see women who are having horrible experiences in menopause because their progesterone is just so low once their ovaries have retired. And often what we have to do is we have to really work on the stress levels, like, on the stress perception. And we have to really work on allowing melatonin to naturally come up. And the only way to naturally get melatonin to come up is to really cut out all sorts of blue light once the sun sets, or like wintertime when the sun is setting at like 4. That's really hard, right? So like around 6, by the latest 7, which means that you have a red color filter on your phone. You have the f.lux software, f.lux software downloaded on computer if you have to do computer work. You either have a blue color filter on your television, or you wear blue blocking glasses, like the real ones, not the ones for daytime with your computer, but like the amber colored ones. And that's what you do in order to like try to get those menopausal symptoms under, like instead of being like this, in a more like zone of comfort, because it's when we get into these extreme zones, so like extreme hot flashes, extreme night sweats, extreme low mood, depression, and irritability. That's not good. It's normal to have some of those feelings as you're transitioning, but there, at some point in time, there's like the body gets used to the transition, so to speak, and then the adrenal glands, if they've been nurtured, right, if you've been taking care of your perceived stress, they can pump up their progesterone, estrogen, and testosterone production. Testosterone is the muscle mass hormone, right? It's the the strong hormone, it's the libido hormone. It's super important for women as well, not just men, right? And again, if you're increasing your cortisol, so remember it's pregnenolone, progesterone, cortisol. Pregnenolone is also used to make DHEA, estrogen, and testosterone. So if you keep pulling the building blocks into cortisol, eventually your testosterone is going to go down in estrogen. Estrogen is the va-va-voom hormone. It's the full lips. It's the curvaceous breasts and hips, the plump skin, right? So you want to make sure you have sufficient amounts of those hormones. And one of the best ways into that is through the stress hormone cortisol. The other way that cortisol is released is if you're eating your fast carbs. Remember, back to the fast carbs conversation at the beginning of this presentation, go to the About section in the Wild Wisdom for Women with Dr. Patricia Mills, MD Facebook group, About section. Download the free ebook. I explain what that is. And if you eat a fast carb, what happens, your blood sugar goes up really high, and then your blood sugar tanks because insulin has to be like massively released. And when your blood sugar tanks low, right, that's when you have low, when your blood sugar tanks low, that's a stressful event for your hormones. And what happens is that cortisol is released. And so that cortisol is released to low blood sugar because one of the things that cortisol does is it helps the liver make sugar and dump it into the bloodstream. So you could actually be really imbalancing your hormones through your diet by eating a lot of fast carbs. Okay, so so this is why I think I see the other reasons. So there's three reasons, top reasons why I see women really suffering in menopause, and there's more, but the top ones are the cortisol hormone is being over released through physical, mental, or emotional stress, or through melatonin being dysregulated, like lots of blue light exposure after a certain time of night. The other reason is insulin hormone. So fast carbs in the diet triggering insulin so high so that it triggers cortisol. The third reason is the use of oral contraceptive or other hormonal replacement therapies, either injected or IUD with a Mirena or a patch. Because why? When you add those hormones during your fertile years, we know now that it causes inflammation in the body. It changes the way your brain communicates with the ovaries, which means that you don't even have that normal ovarian functioning happening during your fertile years. So when it comes time to transition through menopause, it becomes even more problematic. Like it's like the body's been offline, so to speak, for a period of time. And there's research to show that there's this post-birth control syndrome where even after you stopped the medications, if you don't do things to correct the imbalances that these medications occur, like depletion of B vitamins, depletion of magnesium, zinc, those kinds of things, then you go into menopause in a depleted state, and it's really hard for your adrenal glands need B vitamins and they need vitamin C. It's actually one of the largest storage of vitamin C is in the adrenal glands. Okay. So there's so many reasons, and I just wanted to give you a taste of what is going on in your body. Why is it happening? Okay, so that it might be useful to you to better understand and at least give you an idea as to where to start. And obviously, if you're premenopausal, this is a really good time to start making changes. But even if you're in menopause, we say postmenopausal, but technically it's actually you're in menopause for the rest of your life once you go through perimenopause. When you're in menopause, this is still extremely relevant because you want to keep your cortisol levels low. So you want to keep your melatonin high at night. You want to keep your insulin levels stable. You want to keep your cortisol from being triggered due to too much physical, emotional, or mental stress, right? Because all of these things are going to help. So I'm just going to see if there's any more questions. And oh, hi, Bev. Nice to see you too. Hi, Jackie. Wonderful to see you as well. Glad to see you'll see the replay. And Susan, sorry that the connection is, I've closed everything and I don't know why the connection is so hard. I will I'll have to problem solve that one too. It's on my list of things to do. I hope you found this useful. I'm going to give just a second to see if there's any other questions from anybody who has had an opportunity to watch this live. and I don't see any coming up, but I'll just give a few more sessions. And I wanted you to know that if you're watching this live and it's today, it's December 1st, 2021, I'm actually hosting a free masterclass next week called Body Wisdom, where I go into like very interesting details about your health. So if you haven't yet done so, I highly recommend you sign up, because we're going to go through some really cool stuff that I think every woman should know. And I don't see any more questions or comments. So thank you, ladies, so much for joining me, the ladies that joined me today. Thank you, Ursula. I'm so glad that you liked the explanation. I appreciate it. There's so much more to talk about. It's hard to fit in the topic of menopause in like half an hour. So of course, as we go along, I'll be adding on and revisiting a few things, because it's repetition is key. And then I can layer on new information as we go along. Okay. So I hope you have a really wonderful rest of your day, evening, or night, depending on when you catch this replay. And I'll see you next week. Bye.